Welcome, everyone. This is Global Water and Sanitation Discourse on Water and Sanitation, where we talk about different thematic areas and invite different guests. I'm Isha Basyal, the Deputy CEO at the center, and today we have Mr. Ramakant Duwadi, who is a PhD student here at AIT and also a superintending engineer at Ministry of Water Supply, Nepal, and also is a former Director General at the department. Welcome, sir, for this podcast.
Thank you.
So, sir, it's been wonderful to have you here. And now, from being a Director General to being a student again, how does it feel? Let's start from there.
Well, it's not so easy to describe in words, but after serving more than 2 decades in civil service of Nepal, government of Nepal, I have been a PhD student here in AIT since last August 2023. It's been really amazing, and I'm recalling my earlier days during my student tenure while I was pursuing my master's or bachelor's degree. Actually, I'm learning quite a lot, and I'm revitalizing my potential, my strength. So I think I made a right decision to become a PhD student in late 40s.
Late 40s, yeah. So, and then it must be also a unique experience sharing a classroom with youngsters, right? Like, how different is it in terms of their knowledge on sanitation and water, and given your past experience of, a prolonged experience, on-ground experience, is there can you be buddies with the youngsters, or how is it with young students, fellows in the class?
Yeah, I had a mixed feeling. I mean, in terms of knowledge, theoretical knowledge, some new learnings, new ideas. Youngsters are also quite smart, but in terms of experience, real practical experience, so I was able to disseminate those experience with them, and it was kind of mixed feeling, and I felt quite comfortable to pursue some of the courses of PhD. So I felt comfortable, and I also learned from them. I also got some sort of assistance, some sort of help from them, and I also tried my best to make them aware of how the real things will take place in practice on field. So I think it was beneficial for both of us.
Even I myself am also trying to see if I should pursue PhD, right? And given with some years of experience now, does it give some clarity to us in terms of when we are trying to define a PhD research or so, does it help? Because I'm still trying to figure it out. Maybe your insight would be a little helpful. Does it give you a clarity when you are planning to decide on the PhD research that you want to do?
Yeah, of course. So doing a PhD is definitely a new journey, and it's a matter of immersing in a research. So deeply diving into the research field. So research is something different than normal study. So it will help you to analyze the things in a scientific manner and to make a critical comment. So because in order to analyze the things from both sides, positive as well as negative, so some evidence, you will look for some evidences, some scientific facts, some credible and reliable sources. So whatever is going on, your research will try to find out what should be done in a scientific manner. So that's what PhD is important for.
And I'm sure, like, given your past experience of working on ground, and this is definitely going to be helpful. So moving to your early days of, like, when you just started as a government officer, I mean, like, what was the motivation to even start as a government officer, right? And then, like, to reach to a director general position, like, can you take us through that journey? Like, how was it sanitation or wash then, and what changes did you see during your course of time? I think that would be wonderful for our audience to listen to.
Yeah, actually I joined the government service of Nepal since 2004, and after 6 years I got an scholarship to pursue my higher degree, that is Master of Science in Environmental Sanitation from Europe, Belgium. That's what I completed in 2009. After that, I got promoted to senior divisional engineer and posted in the Department of Water Supply and Sewerage Management. Since then, I have been directly involving in water and sanitation sector. So when I used to be divisional engineer in some of the districts, I had an opportunity to work closely with the community, with the local level government and the district level stakeholders. Actually, if we talk about Nepal, it was declared Open Defecation free country in 2019. For that, I used to work as one of the key players in order to move this sanitation campaign forward. Then after, in 2016, then I again got promoted to the level of superintending engineer or joint secretary, and I got opportunity to work closely with sanitation stakeholders, water and sanitation stakeholders, and actually, in case of Nepal, Nepal had formulated one National Sanitation and Hygiene Master Plan, 2011. That was very much helpful to drive the sanitation movement, and fortunately, Nepal was able to declare the country as open defecation free country. I have seen many progress in terms of providing basic sanitation services, but a lot of things are still remaining. Long way to go when it comes to providing access to safely managed sanitation as per Sustainable Development Goal number 6.
Yeah, and it's interesting that you mentioned that you were also a driving force for achieving that ODF, and that's a remarkable achievement for any country. But coming down the line, we also see that there is some kind of a slippage, right, from ODF status to like 2 to 3%, or I think nearly less than 5%. Something we had 5%, right? Um, uh, and what is the challenge you think is in terms of sustaining the status, but also at the same time providing sanitation services? Like, why is it that we are not being able to sustain the status, but also at the same time services as a country?
Yeah, like you said, so in 2011, 2021, Central Bureau of Statistics took National Housing and Demographic Survey. So by that, around 4.5% of slippage is still there. There may be several reasons behind this, such as maybe at that time people used to have some temporary type of toilet facilities, and due course of time some latrines or toilets got damaged with maybe disaster, because we had earthquake in 2015, and frequently we face flooding and so landslide and so on. So the one reason could be some natural disasters, and another reason is in the absence of sensitizing or empowering the community or households, they may revert back to the open defecation. So that's why we used to say, like, we need to build Latin in their own mind. So I mean, they should internalize the importance of having access to toilets. This is for their dignity, for privacy, for health, for development, for everything, for their prosperity. Now the local government is taking care of those issues, and open defecation free status means there should be at least 100% access to basic level of sanitation. So it's being improved, but still some are displaced from the disasters, and some are making new houses. So some people are sharing the toilets. So sharing of toilets is one option, but every household should have their own access to sanitation.
So sanitation is something that receives a little less attention, right? But water is something that, in terms of investment, in terms of infrastructure, we see more investments coming in. How is, when we compare to water infrastructure and services situation in Nepal than in compared to the sanitation?
Sanitation and water both are equally important for us. However, the policymakers and the investors even the donors prefer water supply, give more preference for water than sanitation. This is because the demand is also more predominant in case of water as compared to sanitation. The Constitution of Nepal has made a provision of fundamental right to have access to clean water and sanitation, but The budget allocation is more in case of water supply than sanitation. So the reason could be the less demand for sanitation from the communities or even from the local government. The underlying reason for lower demand to sanitation could be due to the lack of awareness, lack of awareness of importance of sanitation, because sanitation means many people think like sanitation means having access to just toilet. So that is not the end of story, but rather toilet is the point where the sanitation journey starts. So we need to think the sanitation service chain from containment, emptying, transportation or conveyance, treatment, and end use or reuse. So we are talking about safely managed sanitation as per Sustainable Development Goal target 6.2. But nowadays people are being more aware, and the demand have been raising for fecal sludge management as well as wastewater treatment and so on. The scenario has been improved.
Yeah, it's changing. And also just to highlight that if we drink water or even if we eat something, sanitation is a consequence, right? Like of course, so the just as you said,
cause and effect,
right? So but it's just that lack of awareness probably to relate any of the health impacts or this with sanitation is something that has less importance on sanitation, and probably the investment and developing this awareness and capacity building probably is the need. But then you also touched upon the local governments, right? And they have the mandate to provide sanitation services and all, but governance is something that is very critical to ensure the existence of infrastructure or services and their sustenance. But just coming back to the context of Nepal, where now we have 3 tiers of government, and do you think this kind of this kind of structure where there is also the responsibility on each of them also create some kind of confusion to achieve SDG goals? Or is it really helpful? Because although local governments have the mandate now, they have the right to make their own laws and rules. Is it possible? How is it? Is it good or is it beneficial? Plus minus? How would you rate that? Give us any insight on that.
Since 2015, Nepal became a federal Democratic Republic of Nepal, having 3 tiers of government: federal, provincial, and local. As per the new constitution, water and sanitation, or water sanitation and hygiene, are shortly what we call WAS. So WAS is one of the concurrent function of 3 tiers of government. That means each level of government is responsible to provide access to clean water and sanitation. Having said that, there are some merits as well as demerits of having federalism in the context of Nepal. Since WAS is one of the concurrent function, so there is a likelihood of having duplication of efforts and duplication of resources and lack of coordination, because each government is autonomous. So they have three power: executive, judicial, and legislative. So three types of power they can exercise. So they can have their own legislation, their own law. Of course, the local level law or provincial law should align with the federal law, and federal law should not be deviate from the constitution itself. And Nepal's one of the good thing is Nepal constitution says that every citizen shall have right to access to clean water and sanitation. So 3 tiers of government all are responsible to provide to fulfill these fundamental rights of the citizen. In case of provincial and local level government, since they are new set of federal structures as compared to federal government, the institutional capacity as well as the technical capacity and regulatory provisions are not yet fully materialized. So they are still growing and still learning, not yet fully equipped with all those logistics. But they are trying their best. Frankly speaking, waste sector has not been a priority sector in case of Nepal for local level government and also for provincial government. But the federal government has a dedicated Ministry of Water Supply, as well as a separate department for water supply and sewerage management. But what happened after federalization is due to the lack of proper and effective coordination mechanism. So there is, due to lack of coordination, there is some sort of duplication of efforts and resources after the federalization. However, federal government deployed many engineers and technical staffs to province and local level government, but they are not fully institutionalized. There are some merits because they can make their own decision, and some very few municipalities have given a high priority for water and sanitation as well. But most of the municipalities do not give more priority for waste sector as compared to, for example, road sector and other
visible
sectors.
Infrastructures.
Visible infrastructures. And federal government, as the most of the staffs were adjusted in provincial and local level government in Nepal after federalization. So federal government itself is running out of staffs with a limited number of staffs. They are implementing a large scale project, national level programs. In addition, the federal level government also capacitating the new governments, local level governments as well as provincial level government through a national water and sanitation training center under the department. We should work in close coordination, collaboration, with due respecting the coexistence of the all 3 tiers of governments.
Yeah. Because as we see that, probably a national level mega scale capacity building is a need, including prioritizing the sector itself. But then, I remembered one thing, that even the constitution mentions that the people can fine the government for the pollutant or things like that. Has government ever received any complaint and paid a fine to the individuals? Because the constitution mentions that.
Yeah, as per Article
Yeah.
31, every citizen has right to live in clean and healthy environment as per the constitution. I don't think that type of
That right has been exercised by anybody.
exercised. But I mean, yeah, based on that constitution, we need to have the act. So in order to operationalize the constitution, we should have act, regulation, some standards, and so on, directives and so on. Yeah, there are also standard for domestic wastewater effluent standards, but hardly been followed, because Nepal, in case of Nepal, almost 90% of people or households rely on on-site sanitation, and only about 10% are connected to the sewer system. Out of 10%, around 3% is connected to the treatment system. That means whatever wastewater is connected to the public sewerage system, almost 2/3 of them is being discharged without any treatment, polluting the environment, water bodies, and fecal sludge from 90% of the household is also dumped in a nearby water bodies or in a farmland or wherever comfortable for them in a very unsafe manner.
Yeah, and does this like having these 3 tiers of government, or government itself not being not prioritizing sanitation, is it also relating to getting investments from the IFIs or the development partners? Because Nepal does not attract a lot of funding for sanitation also, right? Like, is that the reason, or what is the reason for Nepal not attracting a lot of investments?
Yeah. Broadly speaking, one reason could be the political stability, frequent change of government. After changing of government, then the change will also, I mean, the impact will also take place in bureaucratic level. So stability, overall stability, political stability, legal stability, institutional stability is the prerequisite for any development partners or donors or investors. In the recent days, in terms of legal perspective, we have a new act, Water and Sanitation Act. We have a very recent dedicated act for water and sanitation that lays a strong foundation to move forward water and sanitation sector. And we have water quality, I mean national drinking water quality standards, as well as domestic wastewater effluent standards, and so on. I mean, yeah, in terms of legal tools, we are I mean getting well equipped. In addition, we also have Nepal, I mean, yeah, national water and sanitation policy, a newly formulated policy. The new policy has made a provision for one provision in the area of sanitation. For example, every municipality should be able to prepare municipal water sanitation and hygiene plan, WAS plan at their municipality level, and they should follow citywide inclusive sanitation sewage principle. That means everyone should be included under that comprehensive planning, including urban poor or vulnerable people, marginalized people, differently able people, women, and every section, vulnerable section of society should be included in the sanitation access. So shared and non-shared sanitation should be provided as per the actual need, including fecal sludge management as well as decentralized wastewater treatment system and so on. So if we could follow that sewage principle at each municipality level, then I think many development partners or donor will be able to make a decision where to invest in, because they will prepare a WAS plan. We will use web-based GIS-enabled ANWAS MIS apps. So based on, utilizing that web-based and geo-referenced MIS apps, we will be able to identify what are the gaps in meeting SDG 6 and what could be the potential plan of actions to achieve that goal. So that will clearly indicate how much of investment will require and what are the major activities to be done. So based on that, in close coordination and collaboration between the three tiers of government, in the coming days, I hope we will be make a clear and comprehensive plan for providing access to sanitation and water.
And it's clear that it's not only the attracting the investment from outside, but also the government being able to invest, right? Like just looking at our neighboring country, India, has a huge investment from the national level, from the government itself on sanitation. And Mr. Modi ji running his third term, he sensitized, and this is all led under his leadership and all. Do you think Nepal also has a prospect of having such kind of, investment or national-led initiative on sanitation or water and sanitation and hygiene?
When Nepal was declared open defecation free country in 2019, at that moment, the country was not only declared ODF, but Nepal also committed to move towards total sanitation movement. But after declaring ODF at that time, the progress, the pace of total sanitation movement is not that good as expected. It's rather slow. But a strong political commitment matters a lot. Hopefully after having a new regulation, and people are also becoming more and more aware of environmental pollution, personal hygiene, access to sanitation and so on. In the coming days, I hope the situation will and should be changed, and in close coordination and collaboration with government actors as well as international community. Nepal can make a remarkable progress in terms of providing safely managed water supply as well as sanitation. So there is a huge potential, but in the absence of strong institutional arrangement, and in the absence of strong political commitment, it's a little bit lagging behind. But there is no any other options rather than moving forward to achieve sustainable development goal by 2030. However, it's not an easy job. And
Yeah, and working in the region, what we also see is that it's not that there are not policies, right? There are all necessary policies or guidelines or laws are there. But what is lacking is the enforcement, right? Enforcement is one key thing. And that is quite related with the sustainability of that infrastructure, or also in terms of these services. And that is one thing that I have learned quite much, is that of course the policies and all the necessary documents and the things might be there, but until and unless we don't have proper enforcement, it's not really possible, right? And now you also talked about some of the good examples that Nepal has, and water operators in rural community for Nepal is quite an example, right? Like the community themselves managing the water infrastructure, and then running the services. So how do you, and what do you think, in terms of sanitation and all that are there in Nepal which others can learn from us, and what are there which Nepal should actually learn from from the region, right? If you can highlight some from your experience and from your knowledge, that would be very helpful.
Well, like you said, in Nepal there are many water users and sanitation committees who are running their water supply system very well, not only recovering the operational cost, OPEX, operational expenditure, but they are also paying back the capital expenditure to the government, federal government. Many water operators, community-based users group or water operators, even paid the loan back to the government in 100% ratio as well. But so it depends on the service area, depends on the integrity of the water supply system, depend on the functionality and sustainability of the water supply system. One thing that can also be replicated elsewhere apart from Nepal, that if community is committed and if they are capacitated and empowered, and if some projects is handed over to them, then they will be able to operate the system in a sustainable manner. But it depends on the area. For example, in a core urban area, that may not be so appropriate, and in a remote area, that also may not be suitable. But it depends. The appropriateness should be checked in advance. But community-based approach is one of the good approach that can be replicated elsewhere. And we also During the last years, before declaring Nepal ODF, the leadership was from the local level government. The actual leadership was provided from local level government, municipalities, and the community were actively participating, and other partners, other development partners, NGOs, INGOs, and federal government were just supporting them. So in the leadership of local level government and ownership from the community, we were able to make a remarkable achievement in a short span of time. So that kind of social movement can be very much helpful in raising awareness and we are talking about providing universal access to everyone, leaving no one behind. In order to do so, I think we need to work closely with community. Likewise, one of the successful approach in Nepal is implementing a project on co-financing basis. Earlier we used to have a ratio of 50-50. Now we are practicing 70-30. 70% from government, maybe either from federal government or local level government, and 30% from community. So 30% of the capital investment will be borne by community, and after handing over the project, they will operate it from the service fee, from the revenue of water and sanitation. They will recover their operational cost, OPEX, as well as they will also recover for the capital expenditure to recover their 30% weightage. So that is co-financing will have strong understanding between the government as well between the community. So especially in federal context, that type of co-financing project could be useful in order to provide access to safe water and sanitation in an expeditious manner. So that's what anyone else can take lessons from Nepal. And as far as learning from other countries to Nepal, there are many things to learn from Nepal, because Nepal is a vulnerable country to any type of natural disaster as well as climate change and so on. So we need to adopt innovative technologies, as well as we need to expedite the concept of citywide inclusive sanitation for providing access to non-shared and shared sanitation. I think the India and Bangladesh is moving forward with these all new concept. And Nepal,
are we also moving ahead with that?
We are also trying to move. As I said earlier, Nepal new WAS policy 2023 has made a clear provision of preparing WAS plan at municipality level following citywide inclusive sanitation principle. So that is a policy-wise mandate, policy direction for every municipality. And Department of Water Supply and Sewerage is providing support and assisting to prepare municipality level WAS plan. So that plan consists of all the related, required activities related to water as well as sanitation.
Yeah. And as per my experience, working with the Virendra Nagar project, what I also learned is engaging community gives them a sense of ownership, and also some kind of a purpose that it's a project that you have to sustain, and that's why they are very much motivated and driven to keep it running. But another interesting thing was also in terms of the tariff collection. The revenue collection was very much high when the community was mobilized, because they make sure that it's there. So nothing like empowering a community to run the services and provide that. And I hope because there is a lot that works in a rural setting, and as you sir said very well, that it has to be need based, actually meeting to the need, right? Like we can't just take the community water based operators to a city, but to a certain extent there are a lot that we can learn, right? And that can be replicated. So coming back to your PhD now, like, how do you think all of this is capsulated within your PhD research? What is it really about? We would be very much interested to know. And and how do you think it would help address the next problems of sanitation, climate change, or gender related things for Nepal, or your scope of study?
Yeah. So my PhD dissertation is all about integrating, the potential adverse climatic impact into safely managed sanitation. So sanitation itself is not gaining as high priority as water supply. This is one of the lagging sector. That is why I'm really focusing on how can we make such an innovative approach or innovative framework which could provide solutions, cost effective solutions, equitable solutions, to provide safe, sustainable and equitable sanitation service. Sewage principle itself, or citywide inclusive sanitation service framework, also explicitly talks about the sustainability, equity and safety of whole sanitation service chain. However, it's a little bit silent about the climate resiliency. Climate resilience is all about making our sanitation systems resilient to climatic shocks or extreme weather events. That means even during and after the extreme climatic events, the sanitation systems should continue to operate. They should not be interrupted, because it is one of the essential part of our life, basic need, and environment should not be polluted. In order to consistently safeguard the public health, the sanitation service should be quickly resumed even after the extreme climatic shocks. So it should have such a adaptive capacity to recover quickly, to resume the service quickly. That's why basically the climate change adaptation should be integrated into our sanitation system. We should be well prepared in advance in many dimensions, many aspects, such as economically or financially. We should be well prepared. Institutionally, there should be adequately trained and enough staffs, and likewise our based on the catchment area environment, we should be able to predict the future climatic risk, and that should be mitigated, that should be taken care of. And socially, the community should be resilient, community itself should be resilient, and they should know what climatic risk is all about. So I mean, from different and another major aspect is infrastructural aspect. Our infrastructure should be climate resilient. It should still withstand even during and after the extreme event, adverse climatic conditions and disaster. So I'm trying to explore the possible new novel approach or new frameworks, and trying to explore the indicators. So there should be some set of indicators in order to say that this system is climate resilient. In order to prove or in order to monitor whether it is climate resilient or not, we need to have some set of indicators. So I mean, we will be focusing, my research will mainly focus on exploring that type of indicators to become a sanitation system climate resilient. And I will be trying to explore and find out innovative novel approach or framework in order to operationalize the climate resilient inclusive sanitation, particularly in the context of low and middle income countries. So if I will be definitely taking a case study of Nepal and focusing mainly on Nepal, but that findings will also be helpful for other developing countries, particularly in low to middle income country settings. Yeah,
this is definitely the need of the hour, climate change, and how to remain climate resilient. And sanitation is one sector that I'm very fond of. I really like the sector because while we are not only talking about infrastructure, we are also talking about the enabling environment, the finances, right? Social, all of it.
Institutional, and economic.
Yes. So and now also making it in terms of looking from the climate change perspective, also the gender perspective and all. And it's very interesting. I really like it. What do you have to say to the youngsters, who are maybe pursuing or trying to seek career in sanitation, or trying to even study, the water and sanitation or this sector? What would you suggest, like, for them?
Well, I have many things to say, but briefly, what I would like to say is that this sanitation, water and hygiene, briefly what we call wash sector, is such a sector which is not a luxurious option. It is a mandatory option. This is essential part of life, fundamental rights it is also regarded as human rights by United Nations, and being a basic need, being a water and sanitation professionals, we should always think of providing innovative, cost-effective solutions to provide universal access to every people in this across the globe. And in order to provide innovative solution, definitely whatever solution we are going to propose or we are going to apply in the field, it should be backed up by some scientific facts, scientific research. So systematically carried out research will tell us what is right and what is wrong. So we should choose the right options. So in order to choose the right option, we should focus on research, and based on the reliable and scientific research findings, if we could apply that in the real field, then definitely that will help to meet our objectives. So in addition, what I would like to further suggest is that never stop learning. It's a never ending process, and I'm just starting my PhD in late 40s, so it's not late to learn. It's not always late to learn. You can learn anytime. So and if you work hard, then success will follow you, and if you love your work, you don't have to work.
Okay. Yes, thank you so much, sir. And then I'll take your advice of we should never stop learning, and you are doing it in your late 40s. I wish I can pursue my PhD in my early 40s. Let's see that. And then all the best for your PhD, and all the support that we can extend to you. The GWSC Center is always there. And I'm sure your research would be beneficial not only to Nepal and, as you said, to all the other low and middle income countries. Thank you once again so much for your time. And of course, we'll find next time to catch up again. Thank you so much.
I also thank AIT and Global Water and Sanitation Center, GWSC, for this opportunity and having me here. Thank you.
Always, sir. Thank you, sir. Namaste. Namaste.